David Munkley is the World Vision Director in Eastern Democratic Republic of Congo, and he's joining us live from Goma. Thank you very much for your time, Mr. Munkley. Firstly, what are you hearing about exactly where and how the virus is spreading?
Well, the virus is spreading throughout the camps. It's actually nationwide, but what we're seeing is particularly in camps where people have been fleeing conflict. These numbers have been rising precipitously due to the fact that the conditions are so poor. These are horrible conditions, a lack of sanitation services, really a lack of understanding of proper hygiene. It's extremely difficult, and as such, this is hitting people, and the numbers are going up very quickly, particularly towards children, both in the overall number of cases and the mortality rate.
Are they going up particularly among children because of the number that is staying in camps, or is it also because of the strain that's spreading at the moment, where we're hearing that it is affecting children and pregnant women more?
This strain is cause for concern, but as well, when people are coming to the camps, when they're fleeing from this conflict, they're not eating enough. There's many reports of sexual abuse. So people are in a very difficult position, especially children. They're really the ones that are most neglected. So if a child is only really eating once a day or once every couple of days, their immune system is a little weakened. So the fact that a stronger strain can come and hit these camps mean that children will be most affected by this.
Yeah, they say that this virus thrives in conditions of squalor and intimacy. We know that many people in DRC are living in displacement camps because of fighting between the army and M23 rebels. Can you tell us exactly about the conditions in these camps, and if it's even possible to contain the spread in such conditions?
Yes, World Vision, as well as several other NGOs and the humanitarian community, we've been active in the camps on providing really emergency food and cash, water, sanitation, and health services. Simply put, though, it isn't enough because these camps spring up very quickly. For instance, I was in a camp called Lushagala the other day. There's over 100,000 people in this camp, and the conditions, they just overwhelm the humanitarian community. It is possible to meet these growing number of cases, but we require the resources to do so. The infrastructure is there, but there was an incredible pressure on the humanitarian community to really meet the rising demands.
And what about the vaccines? Are the vaccines there?
Not enough. And we hear about several nations now requesting more vaccines, but it's something that, again, I would ask those resources are marshaled towards the DRC and neighboring countries, because that's where the greatest problem is. We have much more confidence in, for example, as Sweden, or even we've heard about Pakistan having new cases. But in the DRC, there's so much more demand for vaccines, and that's why we request that those vaccines go to where they're most needed.
And are those requests being heard? Are there efforts being made to get the vaccines to the African nations that need them the most?
It's very early in this. We are concerned that those concerns aren't being heard or acted upon appropriately, which is why we're here again to advocate for greater vaccine usage, greater resources, because so many of the solutions that we're going to come up with will be local solutions: good hygiene promotion, early detection and surveillance, ensuring that camps have appropriate hygiene and health support. Right now, that's not the case.
Mr. Munkley, thank you very much for your time on this, and do apologise to our viewers for the sound quality in that last answer, but it was great to have you with us. Appreciate it. Thank you.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.